Hello, can you hear me? Okay. So is it clear and is it all right? Is there any disturbance or can we start? Okay. Yes, so today we will continue our discussion on the pharmaceuticals. And today we have only a 90-minute schedule. But in our next webinar on Friday, we will have 3 hours, and I plan to complete this module with our next webinar on coming Friday. So today we are going to go further and look into the uh, simple preparations. In our last webinar, we talked about the water-based extracts, and now we look at dry preparations and how by combining dry and water-based preparations, we are making some complex dosage forms. I will also discuss today how in actual the industrial practice of Ayurveda, we have modified many of these procedures. At an industrial level, it's important to know what's the difference between the classical and the industrial way of doing these medicines. So today we will first of all look at the dry preparations. Uh, so in our previous webinar, we studied about the five water extractions, the fresh juice, then the decoction, then the paste, and then the hot and cold infusions. Now, this is the most common form in which Ayurvedic medicines are administered world over, and this is the dry preparation. So, when herbs are processed without adding any water, that's when we call it as a dry preparation. So, in this, the most important thing, in according to Ayurveda, is that the herbal powder should become microfine, because otherwise it doesn't really get completely digested and absorbed into the body. So we know the concept of nano particles. The more minute it becomes, the better it is able to. Its even activities are very different. In herbal powders, we don't really make them into a nano form, but we really make them microfine, and it shouldn't be irritating to the tongue, or you shouldn't be able to feel any particles when you take these herbal powders. So most of the time, we do not completely pulverize the herbs. In ancient times, it was difficult. When you do this with your hand, it's really very difficult to powder the medicines to that fine state. You need to pound the herbs several times over. But today, with modern technology, with all these equipments, it becomes much more easier to pulverize the herbs. The dry preparation is powder. This is called as a churna in Ayurveda, and this is the most common form in which uh, Ayurvedic medicines are administered world over. And I was mentioning in Ayurveda, this is not advised except in very specific conditions because powders are very potent, very strong, and we are taking the entire plant. So the chances of it producing more side effects is high when we use powders. But now today what we are going to discuss is powders are used in Ayurveda as a preparatory process for making more complex preparations. So this is the importance of powders in Ayurveda. Powders are not directly used except in limited conditions, but powders are made first to make more complex preparations. So powdering of the herbs in that way is always a very important therapeutic process in Ayurveda. So the herbs have to be washed clean and then dried. Shade drying is generally recommended in Ayurveda. Drying under the hot, direct sun is not uh, normally recommended. And after drying, we have to ensure that during the process of drying there's no contamination, and then the drugs are powdered to a microfine state. So if this is not used as such immediately, it becomes a raw material for making more complex preparations. And today we will see what those more complex preparations are. So here you can see the picture of herbal powders, the different colors. So when you have individual herbs, you can get a very colorful, array of powders. Each herb has its own distinct color, its own distinct order, and its own distinct flavor. In the traditional system, it was there was a practice of training the physician to identify herbs just by tasting. So this is just like tea testing. Today we have wine testing, tea testing, where these substances are tested by specialists who will taste these substances and then tell the quality. So in traditional system, this practice was also followed. So and powders were used commonly to do this testing. That you make the powder and then you taste the herb, and after some time, without knowing what herb it is, just by tasting the powder, you would be able to identify what herb it is. I know of physicians, even if you mix many herbal powders and give it to them, they are able to identify at least the main ingredients that are present. So, so this is about powders, and now, now we are ready today to go into the first type of a complex preparation. So, when you combine a wet and a dry preparation, then complex preparations can be made. So I hope this point is clear. Making herbal powders in Ayurveda is not to directly administer them, but use them to make more complex preparations. So in Ayurveda, the most basic of such complex preparations is what is called as a pill or a gutika. So I want to clarify here that the pill should not be confused with the tablet. The pill in Ayurveda is very different from what we understand as a tablet in modern medicine. Modern tablets are really very different. So I will explain it as we move forward in a webinar, what's actually the difference between a modern tablet and a traditional pill. In Ayurveda, a traditional pill is called as a gutika. Has anyone heard of this term? Okay. Yeah, so gutika is a pill. So when you combine, like for example, you take a fresh juice of a plant and then dried powder of another plant, mix them, and then grind them till it becomes a very fine paste, and then you hand roll the paste, and then it becomes small pellets, which we call as gutika. So this is how in Ayurveda pills are made, and it's very different from the way tablets are made. As we move forward, we will try to understand more of the differences. So is this much very clear? Do you have any? So just to summarize, uh, we are trying to, we discussed about two preparations. Okay. So one is the water extracts and then the dry powder. So by combining water extracts and dry powder, we are able to make what we call as pills, and this is the first of the type of complex preparation that is used in Ayurveda. And now, making a pill or a gutika, there are actually three steps to make a pill. Now, really speaking, you could also try this out. Uh, these kind of pills are actually, why we make a pill is that they are very, very potent. The water extracts cannot be preserved usually. Like if you make a decoction, you have to consume it in the same day. If you keep it for a longer time, like it cannot survive for more than maybe 12 to 18 hours. Within 18 hours, the decoction goes bad and it is damaged. So there was a need to preserve. Like when there was an emergency, you couldn't all of a sudden make a decoction and give it to the patient. It might take a few hours to make it. So they preserved high potent medicines in the form of gudikas. So as an example, if you want a very high potent version of Brahmi, you can make a Brahmi gudika. That is, you will powder Brahmi, then you will also take the juice of Brahmi, you mix them together, grind and grind and grind till it becomes a very fine paste, and then you can roll them into pills, and this can be better preserved for a longer period of time. And when you suddenly need Brahmi and Brahmi is not available, you can take this gutika or a pill, then crush it with water or some other solution if you have a medicated wine, and then if you administer it, it produces a very strong and sudden and quick action. So as an outcome of our discussion, I would also recommend that you can try out some of these procedures yourself, since I think in our previous webinar, Suzanne, I don't know if she is present today. I don't see her. She was mentioning that she has a lot of herbal powders in stock and what should be done with that. So one of the suggestions and solutions is actually to convert many of these powders into pills. And in fact, their shelf life also is enhanced when you convert them into pills. So you could combine 2 or 3 powders and then mix them with some decoctions or, you know, some other fresh juices of plants, and then you grind them and you can make them into pills. Like for example, if you have a lot of triphala powder, does anybody have a lot of stock of triphala powder? If you have a lot of triphala powder, you can also convert them into pills. So you could try this out. The simplest way would be to add some hot water to the triphala powder, and then you grind it and grind it and grind it, and then you roll them to pills. So whenever you need this, these triphala pills can be taken and dissolved in hot water and consumed. So this is a very simple way to convert powders and give them a longer shelf life. Am I audible? Okay, okay, fine. Okay, so now we are going to discuss about how we will make these pills. Uh, does any one of you use pills in your practice? Do you have access to the Ayurvedic pills, or have you used them before? Okay, did you use tablets or the classical Ayurvedic pills? I just wanted to know whether any of you have actually seen the classical Ayurvedic pills. Yes, I will be showing it. I will be showing it as we move forward. Great. Yes, in Maharshi Ayurveda they do have it. So yeah, that's fine. That you know that. I will show you pictures of the pills, some of the pills as we move forward. I have them in my slides today. Fine. So if you have used medicines from Maharshi Ayurveda, then I'm sure you would have seen those pills. So, so now the three steps in making a pill is a pill is something which we can also make at home. But the only thing is you need a lot of patience. You need to keep grinding the powder and the liquids together. Sometimes the grinding has to be done for days and months, and you can also use modern grinders to do this grinding. You can continue it for several hours, which may be more practical than manually doing it. And so the step is that first you make the microfine herbal powder, as we described earlier, and then you start adding liquids that you can use a fresh juice or you can use a decoction, and then you mix them very well in the right proportion so that it's got the consistency in which you can start grinding it. And the third step, you grind this mixture to make a fine paste. So you have to actually mix it to the point that it becomes very wax like. So if we are not careful with the right stage of grinding, then this mixture can easily get attacked by fungus. If there is moisture in this mixture at the time of rolling into pills, then your pills will not stay for long. So you have to reach that point where the water is almost lost, evaporating by your grinding, but there's still enough water to hold the particles together and enable you to. You have to try. In India, I have tried doing it in mixer grinder, uh, we use certain grinders to grind rice grains. So to make them into a paste, we have some special food articles that we prepare, in which paste is made out of rice and other. So such grinders are actually very useful. So you could try a coffee grinder also. Like the only thing is you may need to run it for hours together, and the motor shouldn't get overheated. So you could try it out. So to make very simple gudikas, I mean, the grinding has to continue till the water is very well evaporated. So that's the thing. So you need a motor which can withstand this whole process. So this is how it is done, and by in three steps you reach a gutika. But gutika is also a very time-consuming process. So some gutikas are made over a year. You might be very surprised to know that every day, you add more and more liquids and grind it, and sometimes it takes up to a year. I know of physicians who sometimes, traditional physicians who grind these powders and herbs for almost 2 years and then make the pills. And these are very, very potent. When you make medicines like this, it's like creating emergency medicine. The moment you put it in the mouth, it begins to act and produces very quick results. Okay, so this is the general. There is no preservative is used. If you are grinding properly, then there is no need for any preservative. So that is the technique of making these pills. You will be able to use them for a long period of time. But if you do not, stop the grinding at the right moment, at the correct point, which you can learn through experience, then very easily fungus attack comes. So by the fungus attack, you are able to know. And by a little experience, initially you might lose some of your cutikas because of fungus attack. Eventually, you will know the point. And of course, if you also undergo training under an experienced physician, it's much more easier to learn this. But otherwise, you have to learn the hard way. Okay, so this is about the method of making the gutika. Is this very clear to all of you, the three simple steps? Because I wanted to, from the first, even the previous webinar and today, introduce some of the preparations. No, actually, shade is preferred. Sunlight can affect the properties of the, if you directly expose into sunlight, then a lot of its potency is lost. So shade drying is recommended, but you have to do it in a very dry place and shade drying. That is the method to make the gutika. So you have to, moisture is the real problem. So you have to make sure that there's not too much moisture coming and damaging the pill. Okay, so if this is clear, we move on. So you can see here is a picture of a mortar and a pestle. This is how it was done traditionally, and you can imagine how long it would have taken to make these pills. But technology has definitely made it easier for us. But the problem with big machines is that they generate too much heat. So if you are going to use machines, and too much of heat will actually cause many of the chemicals to be destroyed. I hope you are aware that many of the chemicals in the plants are thermolabile, means they will be damaged by the heat. So even if you are using a coffee grinder or a mixer grinder, you need to keep switching off the machine to ensure that, because we know some of these grinders can become really hot, and at that heat a lot of the useful chemicals will get denatured, and so the pill will not be effective. So that is why this is a slow process. We have to do this process without bringing in too much heat, but we have to maintain the dryness at the same time, and then you are able to make a pill very successful. So, as I was mentioning, the important thing in making a pill is the grinding. And this is sometimes, as I said, done for hours, for days, for months, and sometimes even a year to potentiate the medicine. So sometimes the grinding has to be repeated several times with the same liquid, or sometimes many different liquids are used to make a pill. So this is the idea of a combination in Ayurveda. So as I said, the individual powders are, according to Ayurveda, way too dangerous, uh, because a single herb will do a lot of harm. A lot of unwanted effects can be produced when you use only a single herb. So one of the ways to, and also when we use herbs, herbal medicines are uh, having these effective chemicals in very small quantities. So usually you need to take a large quantity of these medicines to get some effect. This is one of the differences between allopathic medicines and Ayurvedic medicines. In allopathic medicines, you have the pure chemical taken out, and since you have the pure chemicals, then you are able to give it in very small quantities. But in give it in very large quantities, and one of the ways to potentiate a medicine and give it in small quantities is to convert it into a pill or a gutika. So in a gutika, what we do is we do two things. One is that you potentiate the medicine by repeated, processing. So through the repeated processing, we are able to potentiate it. And second thing is you're able to mix other ingredients. So if you take Brahmi and then you grind it in the decoction of Jatamansi, so you're potentiating Brahmi by adding the juices, and as the juices evaporate in your grinding, Brahmi gets potentiated, whereas without increasing the bulk. So as you add more and more liquids, and all of them evaporate as you grind, in a very less quantity of the medicine, you have a greater potent, combination. I hope this point is clear. So, achieving more with less. Yeah, that's a good question. Herb powders in capsules is nothing. It's as similar as just powder. You are only, masking the taste of the herb by putting it into a capsule. So there's no other advantage because it's just the same powder you're putting into a capsule, so the patient doesn't know how it tastes. So if the powder is really very bitter and if it has an offensive smell, the patient is not able to take it and there's nausea, then you can use a capsule. Oh, the lifetime of the powder, of course, if you keep it in a capsule, it has a better shelf life because it doesn't get exposed to air. But you can also put the powder into airtight containers and store them in a dry and cool place. And then also, you can enhance the shelf life. But if you are repeatedly opening uh, the vessel or the can in which you are storing the powder and it gets exposed to the environment, then it's very difficult. I mean, it might get spoiled very easily. So yes, another difficulty with capsule is that some of the herbs need to actually mix with the saliva in your mouth, and unless it's mixed with the saliva, it does not actually, get properly digested. And so these are some limitations, but still it's good to use. The main advantage of a capsule, in my opinion, is that it helps the patient to take the medicine, swallow it without feeling any discomfort. So this is the method of processing a pill or a gutika by grinding it for hours, days, and months, and sometimes even a year, and repeating with several liquids, same liquid many times or several liquids many times, and thus we make a very strong medicine. So if you keep some of these pills, like if you want, uh, you know, the pills are very helpful for giving relief from some acute conditions. So in Ayurveda, it is used for bronchodilation, for example. Or if you want a laxative to be carried around, you want it to work very quickly and you don't want to carry a lot of heavy stuff with you. If you have a colicky pain in the abdomen, medicines for diarrhea, medicine for dysentery, medicine for cough. All these things can be made into gudikas. And so you have them ready when there's an emergency. Even if a plant is not available, you can actually, at least as a first aid, take a pill and then dissolve it in some liquid and give it as an emergency medicine. So this is the advantage of making a pill or a gudika. So is this clear? Okay. So now we look at the size and shape. So the size and shape of the pills differ depending on the dosage of the medicines to be given. It's again an interesting thing. In Ayurveda, we have pills of different sizes. You There are even pills as small as a mustard seed. Mustard seed is really very small, tiny, and sometimes these pills are rolled into such tiny globules, and sometimes they can even be as big as a chickpea or intermediate like a green gram. So this is by deciding. In ancient times they used to compare it with these grains and pulses, and by looking at the size they fix the dosage. So the dose and the size were correlated, and that's how these pills were given different shapes. So the dosage was controlled by the size of the pill. And a very important point, many people do not know this when they take the classical pills. So here I want to again tell you there's a difference between the tablets and the pills. Now the classical pills in Ayurveda, we should not actually uh, swallow them. It's of no use if you swallow these pills. Because if you swallow the classical Ayurvedic pills, they just don't get digested or absorbed and they will be just eliminated from the system. They Without any absorption, because these pills are really very, very hard. Okay, yeah, I'm sorry. Actually, I am doing this webinar from a car, and it's a bit adventurous because in Delhi, I really got stuck in the evening traffic, and so I still have some good internet, and so I decided to. Okay, no, I just kept this to avoid the disturbance. Is it still okay now? Are you able to hear? Can I continue? Okay, okay, fine. So yeah, so I want to tell that we cannot swallow these Ayurvedic pills. Many physicians make the mistake of advising the patient to swallow the pills. So I hope this point is clear. In the middle of our discussion, I just got a bit distracted. Yeah. So the if you swallow these pills without any digestion or absorption, they are eliminated from the system. So before administering them, we have to grind them and dissolve it in some liquid again, and then only it should be uh, taken or administered. So do you have, how do you prescribe pills? Do you advise the patients to swallow it, or do you advise them to grind it? Oh, moringa pill. Yes. From which part of moringa you want to use? Sorry, moringa. Which part do you use? The fruit? You mean leaves? Okay. So, moringa leaves are very fibrous, so it may be very difficult to grind it into a fine paste. So, one of the ways in which you can do this, convert it, is to first take the juice of the leaves. Take the juice of the leaves, and one method is to you have to crush it. In my last webinar, I explained different methods of making juices. I perhaps you did not attend the last webinar. So in the last webinar, I explained how from herbs you have many methods of making juices. If the herb is very fleshy, okay. So you can maybe even listen to the recording, but I'll explain very briefly. If you listen to the recording, you will be able to get a better idea of how it is done. But I'll briefly explain. You have to first see if the herb that you want to take a juice from is fleshy and watery. If it is fleshy and watery, then you can directly crush and take the juice. Some leaves are not uh, fresh, so you have to sprinkle water. Some herbs, just by sprinkling water and then crushing, you are able to get the juice. Some other herbs, you may have to add a little water and then crush and then strain it through a cloth. Uh, and sometimes when herbs are becoming a little dry, you can soak them in water. So there are different methods. But now coming specifically to moringa, I would advise that you should sprinkle a little water, maybe add a little water, then crush it very nicely, and then squeeze it to get the juice. And once you get the juice, so because moringa leaves are a little bit fibrous, so if you directly start grinding them, you may find it's very difficult to make it into a fine paste. You must grind till the paste becomes butter-like. So yes, in the previous webinar, I also explained how should a paste be made. So once you get the juice, you have one option is that uh, you can also parallelly dry the leaves and powder it. So once the leaves are dried and powdered, you can add the juice to the powder of the moringa leaves and then grind it and make pills. Another option is that you can just dry up this juice. As the juice, you heat it slightly on a low fire, and as the water content evaporates, a paste-like substance will be collected. But this will require a lot of juice. So you know the medicine will be very strong, but it's a little cumbersome and tiresome process to do. So what I would advise is that you can take the juice and then the powder of the leaves and mix them and grind them till you are able to roll them into pills. So does that help? So the point is that there are different methods, and depending on the herb and depending on its consistency, we have to decide. So in my previous webinar, I had also explained how decoctions are made, you know, how decoctions are made, how the water proportion changes depending on the thickness, hardness of the herb used. So in a similar way, we have to decide when you make the juice. Okay, so we continue with our discussion. And now, how are these pills administered? So, as I said, we cannot swallow them again because when you make the pill in this form, they become so hard. They are sometimes hard like a stone. So, if you swallow them, the body is not able to break it down, and so it is just eliminated when you move your bowels, it goes out with the stools. So, if you want the pill to be absorbed and digested, then you have to actually grind it in some liquid and so that it is reconstituted and then the body is able to absorb it. And so pills are crushed and dissolved. You can use a decoction or medicated wine or maybe even the juice of some herbs, and then you can use the pill. So the pill is very strong. It will get absorbed and digested very fast in the body because it's become extremely minute by the grinding. So as I mentioned in this form, you can use it for quick results, quick clinical results when you're practicing. So this is about how pills are administered. So I was asking this question, how are you advising if those of you who are using pills, do you ask your patients to swallow them or do you ask them to grind and use it? How do you do it? Are you able to hear? Okay, that's great. I'm happy to know that because even in India, sometimes patients are not aware and they swallow these pills and they don't get the benefit. So that's a very important practical point to consider. Now, this is the most simplest way of making a pill. Take a powder, mix it with some liquid, and that liquid could even be plain water, hot water, as I said, and grind it and make it into a pill. Now, there are other ways also to make it. Pills are also made by blending herbal powders in resins of plants. So, we use some gum like substance, melt it and put the powder and then roll them into pills. So I don't know how many, have all of you heard about gugulu? Have you all heard about gugulu? Do you know what it is? Because if you are studying Ayurveda, then yes, gugulu is a very important thing. So it's actually the secretion from a plant called Commiphora whitei. So it's a plant which grows in very dry regions, in desert-like regions. And from this plant we get an exudate, a gummy waxy substance which is called gugulu. So in this method of making pills, what we do is we take this resin and we heat and melt it to a liquid state, and then we pour all the powders into this melted material, and once it becomes a mixture we then roll them into pills. So this is, and when these pills are also extremely hard and very but and very smooth because of the resin, and these are called as gugulu preparations. I don't know if you have heard some of the most famous gugulu preparations is Yoga Raja Gugulu. Have you heard of this medicine? It's used in rheumatoid arthritis. Have you heard of this medicine? Okay, so there are many pills like this which are used in Ayurveda, and they are very, very strong and powerful. And these medicines have very strong anti-inflammatory inflammatory effect. So Gugulu pills are again another class of medicines which are used as a main line of treatment in many chronic diseases. So here is Gugulu resin. This is how it looks like. Has any one of you seen this Gugulu, the pure Gugulu? Okay, so this is Gugulu, and in this resin we boil this resin till it becomes a liquid, and then we add the herbs, and after mixing them we are able to they can roll them into these pills. So some of you wanted to know how the pill looks after it is made. So here is the picture. Can you see the picture? So the pills, when they are prepared, they look like this. You can see that these pills are shining, and this is because of the gugulu. Okay, so this is the second type of pills that can be made. So here are some examples of the gugulu pills. So the gugulu pills are Yoga Raja Gugulu and Navayasa Gugulu, Kaishora Gugulu. These are all preparations which you can probably get in the market, and I'm sure that those of you who are making the using medicines from Maharshi Ayurveda, I mean, they are definitely selling the Gugulu preparations. So you can please check up whether you're able to get some of these Gugulu preparations from them. Okay, so we have completed two methods of making pills. So was everything clear? Do you have any questions? Can we move on to the next step? Okay, is the audio also all right? I hope there's not too much of disturbance. Okay, so now I'm also going to talk about another simple method of making preparations, and these are granules. They are not exactly pills, but this is another way in which herbal powders are modified to make dosage forms. Okay, no problem. I think you can always go back and come to the recording. Okay, I have a doubt. You mean you had to attend a call, or was there any disturbance in the audio? Please do let me know if there's any disturbance in the audio. Okay, that's fine. Right. So now we are going to discuss about granules. Now, sometimes the powders are modified into granules by mixing with jaggery. So instead of gugulu, jaggery is melted and then the herbs are added and mixed. So this results in the formation of granules which are then used as medicine. So these granules are called as vatakam in Sanskrit. So when you take powder and mix melted jaggery in the right proportion, the powders will form into granule-like material. So this is very helpful. It adds to the taste. Of course, you cannot give this in diabetic patients, but for many other conditions, this is very helpful. Also very helpful in treating respiratory disorders, because in these respiratory disorders, the jaggery also helps to loosen the mucus, liquefy the mucus along with the other herbs. So a very simple jaggery granule that you can try and make yourself is from black pepper, dry ginger, and long pepper. So are these three ingredients available for you? These are called as the three pungents. The three pungents, or it's in Sanskrit called as trikatu. So these three pungents, you can powder them and then melt some jaggery, mix them, and you will need some skill to actually mix them in the right proportion, and then they will become granules. And these granules you can use to dissolve in the mouth, and you can see how this combination very easily clears up throat. So if you have cough or if you have pharyngitis and such problems in your throat, then you can use this combination to get very quick relief. So all the methods that I'm discussing today are things that you can yourself try at home. So some of the basic medicines that are described in Ayurveda are, you know, they are very much like simple cooking at home. This is only the really very complex preparation that you cannot do at home. In Ayurveda, we have simple combinations, formulations, as well as complex. So I'm discussing most of the simple ones, which you can also, try at home. So this is about something's about granules, and you can see this is jaggery. So is jaggery available? It is formed in one stage of making sugar. I see you do not know jaggery. So what is your language? Let me see. हाँ क्या है एयरलाइन एयर इंडिया है D3 में all is in English. So okay, just a minute. So let me see what it is in Polish. Just a moment. Oh, there is no suggestion. So are you able to recognize this material on the slide? Have you? Okay. Let me just see. Just a moment. I will just try once more. So it's a kind of brown sugar. It's a kind of brown sugar. It's in a very early stage of the preparation of sugar. Okay, anyway, so I think we'll not waste too much time on this. The picture is there, and you can maybe find out. In India, this is used very commonly, and this is used for making these granules. So far. So now we move on, and you can see these are granules that come out of this combination. But when you make it crudely at home, when you mix these herbs and jaggery, it doesn't become so even like what you see here in this picture. It's usually of different sizes and shapes, but that's okay. It would still be effective, and that's the key thing. Yes. So now, just to summarize, we discussed three methods of making pills. One was powder plus liquids, and then powder plus gugulu, and then powder plus jaggery. So this much is clear. So now I'm going to talk about another method. Is so much clear? Is it all clear? I'm just asking again because we are discussing different methods, and I want to just make sure that there's no confusion between the different methods that we are discussing. So it's all clear so far. Okay. So we discussed powder plus liquids, powder plus gugulu. Okay, gugulu is the resin or secretion from a plant. Uh, it's from the plant Commiphora vitae. So you can go back and check it, or if you want, I can just show you that picture again. Can you see the picture? This is gugulu. So when you heat this gugulu, it becomes a liquid, and then you add the herbs into the liquid, and then you mix it, and then you are able to roll them into pills. So is that clear? So we continue. So I hope you got a clear idea about these three methods. So now there's a fourth method of making pill, and this is the method I was telling about on how to make pills out of moringa, for example. Here what we do is we first make a liquid preparation. So this is a pill from a liquid, directly from a liquid. The other was pill from a powder. So here we first boil the medicines and make decoction out of it, or we take the juice of the medicines and then you boil it slowly. I mean, we boil the liquid in low heat and till the liquid is gradually evaporated, and then you get a pasty residue at the bottom, and that pasty residue that is obtained is dried further, and you even kind of grind it. Yeah, as I said, resin of Commiphora vitae, that is the name of the plant. In Sanskrit, is that clear? Okay. Yes, so now we are talking about Khanavati, or what is mentioned here is a pill that is made by drying liquids. So what we do is heat the, we make the liquid first, and then we slowly heat it and heat it, and then gradually it becomes paste-like, the residual paste, and then it is, rolled into pills and dried. So this is another way to make a pill. So this way today we have discussed about different methods of making pills, and these are the simplest complex forms of Ayurvedic medicine. Some of these methods we can also use at home. And now I want to introduce to you about some of the modern forms of Ayurvedic pills and the difference between a pill and a tablet. So in modern times, industry has developed new methods of preparing pills. Machines are used for grinding the paste, and excipients are added to reduce the disintegration time. The tablets are sometimes hand rolled, or sometimes they are, you know, machine made. The traditional pills were hand rolled. There's a small mistake in the slide. The tablets are not hand rolled. The pills are hand rolled. I hope you know this difference. You make the paste and then roll it in using your fingers to make the pills when we are talking about the traditional method. But in the modern method, we make the paste and use that, in tablet making machines and then convert them into tablets. and many other substances are added to the tablets to ensure that the tablet, there's something called as disintegration time, which means that when you swallow the tablets, and tablets can be swallowed whereas pills cannot be swallowed. So when you swallow a tablet, the moment it enters into your stomach and mixes with the liquids and the acids, it disintegrates and then gets absorbed, and then it begins to produce its actions. So the main difference between a pill is very hard. A pill is hard, whereas a tablet is brittle. It's not hard. Means the tablet, if you crush with your hand, it will powder, whereas a pill, you will need to really crush it to break it. A pill does not have any excipients. It does not have the additional ingredients to make it soft, whereas a tablet has many additional ingredients to make it soft so that it easily breaks down and is able to get absorbed by the body. So this is the difference between a tablet and a pill. Is this clear? Tablets are machine made, and pills are actually hand rolled. Any doubts? You can please ask if you have any confusions, because you said you hope. Anything to be clarified? You can ask. Yes, the pills should be ground. Pills you have to grind. Tablets you do not have to grind. That is the difference. So it's very important that you understand this difference. Is it clear now? Is this clear? Okay. So now we're going to have a short break for about 5 minutes. It's because I reached my destination and uh, I need to just move out and then set up our conversation again. So let's have a break for about 5 minutes, and then we'll continue and complete our discussion for today. Okay. Okay, so we have just a few more minutes to continue. Right. So as I was mentioning, these decoctions are also spray dried and then modified into pills. And so the basic idea is that these tablets, when the pills are converted into tablets, they are much softer and they are very easily breaking down and digested. So you can see here the spray dryers, huge machines, and these are the tableting equipments which are used in the industry by Ayurveda today. And all the tablets that you will get in the market today are actually manufactured using these equipments. So these are not things which we can do at home. And when you really want to use make tablets on such a large scale to distribute to the whole world, then you need equipments and machines like this. Otherwise, we can make pills at home. So today, if you look at preparations that you buy from the market, I want to tell you some important things. See, you can get coarse powder of herb. Coarse means not very fine. So if you get coarse powder of herbs, hello, can you hear? Okay, so somebody is having a problem. It's not my problem then. So is everybody able to hear? Can I continue? Yes. So, there are coarse powder of herbs, and I want to warn you that you have to ensure that when you use powders, they are extremely fine. Otherwise, they can cause problems. They should be extremely fine. One of the tests to know if they are extremely fine is that if you rub the powder in your hand, it will go into your fingerprints. So that is the best condition. If the powder is able to go into your fingerprints, then it means it's very fine. Now, decoctions are also manufactured, using preservatives. Usually, classically, preparations are to be made on the same day. You have to make it and use it. You cannot usually store it for long. But today in the market, you get decoctions which are pre-prepared, and actually they cook more, so that they cook for a longer period, so that you reduce it to one fourth again, and it becomes very concentrated, and then you add some preservatives, and then when you are using the decoction, you have to mix it, dilute it with water, and then consume. So this is the way decoctions are made available in the market. So if you are in the future trying to buy some medicines from India, or if you come to Indian pharmacy markets, this is a very important difference that you need to know. That one is that they use preservatives, and I will shortly tell you what preservative is used. And because of the use of these preservatives, you might experience some unwanted effects. They are not very serious, but it's important to know and differentiate market preparations with preservatives and those without preservatives. So one is that your powders, if they are too coarse, don't use them. You have to make them fine. If they are added preservatives, then you have to be careful with some patients, because those who are not tolerant may get severe, acidity and other problems. And you also get spray dried powders of decoctions sometimes. So you need a little awareness to be able to differentiate all these kinds of preparations that are available in the market. If in the future you are planning to import some of these medicines, it's important to know that they are available in different forms. That's the reason why I'm mentioning this. Now, maybe I should ask you a question for two reasons. One is I want to know whether you're still able to hear me clearly. And the second reason is that I want to know whether you're aware of these forms of preparation available in the market. Has any one of you seen all these preparations? Have you seen spray dried powders of decoctions? Some people give herbal tea bags. Sometimes you get hand rolled pills. Sometimes you get machine made tablets. And sometimes you get granules with jaggery. So all these forms are available in the market, and therefore you need to be a little careful. So, are you able to hear? Okay. So, decoctions with preservatives. Nowadays, Ayurvedic decoctions are, you know, made by concentrating them, and concentrations are made by additional cooking. And the preservative that we are using is called a sodium benzoate. So, although this is used in very small quantities, this is added for preservation, and then you dilute and use this medicine, and this preservative can sometimes cause some minor problems. So there are some side effects of concentrated decoctions, because in some people concentrated decoctions may cause gastric symptoms like mild nausea and acidity, but these are not serious side effects, and in most patients they disappear after intake of a few doses. So to summarize, I wanted to distinguish between the commercial market preparations, in which there are some variants, and if you're not careful, you can get some unwanted effects, even though they are not very serious, and the classical preparations which you can make at home. So I think we have come to the end of a webinar, and I sincerely regret the disturbances in between, especially towards the end, because I got caught up in an unexpected situation. So what we discussed today was the complex preparations made from water-based extracts and dry extracts, and how by combining them we make different types of tablets, and the difference between pills and tablets, for example, and that pills cannot be swallowed while as tablets can be swallowed. And then some of the changes that have happened as we brought into the market and the industry. And the main thing is the use of modern preservatives, which we must avoid as much as possible. So I think with that we complete, and in our next webinar we'll have for 3 hours. On Friday we will cover the remaining topics, and I look forward to meeting you again. Thank you.